Lead at the Ministry of Health and Wellness. Members of the media, distinguished guests, ladies and gentlemen, good morning and welcome to the official launch of the digital vaccination cards for Jamaica. And we are especially pleased that we're able to advance this today as we are in the season of giving. And so this is one more opportunity for us to be able to enhance our national vaccination program. We're going to begin with remarks from Mr. Peter Melhedo. He's the chair of the Logistics and Operations Committee of PSVI, who has been partnering with us on this and other initiatives on our vaccination program. Mr. Melhedo.
Thank you, Stephen. Is my volume okay?
Yes, you're good.
Okay, great. Honorable Minister, Minister of Health colleagues, UNICEF colleagues, I'm not sure if the eGov India team is watching. It's late in India. Members of the media, ladies and gentlemen. First of all, let me apologize for not being there in person. But I'm going to address you as many things are done today remotely. So, Steve, my only correction to you is that I'm here actually in my capacity as a member of the National Vaccination Operationalization COVID-19 Task Force, but I also am continuing with the PSVI. And in that capacity, as a member of that task force, I've had the privilege of working with three excellent organizations: the Ministry of Health and Wellness, UNICEF, and eGov India, in fulfilling on our mandate to have a digital vaccination certificate available to everyone in Jamaica who has a COVID-19 immunization record. I believe this latest development is an important addition to our current suite of digital solutions, including our vaccination management platform and our online scheduling software. What that really means now is that Jamaica boasts a complete digital, end-to-end digital experience, from scheduling through to record management and now digital certification. I think very notably, Minister, these solutions were developed through public-private partnerships. And as I've said before in similar fora, this is a must in my view for a small country like ours to be able to leverage the best available talent and resources in making these important advancements. And I know you, Minister, will speak more to the efficacy of the new platform, but really my role is to acknowledge the two tremendous contributions made by both UNICEF and eGov as partners to Jamaica. As you'll recall, Minister, UNICEF played a prominent role in bringing online the ComCare system, which is our vaccination management platform. And they've again stepped up by providing significant resources and expertise to this project. And some of those include, and this is not this is a limited amount of things, they've done a lot more, but include sourcing and funding, the project management team. And I have to shout out Janet Smythe-Corey, who's done a tremendous job, as she did with the ComCare system, of rallying everybody together and making sure we deliver on time. Several digital health experts were provided to us, the integration of the ComCare system. The whole cost of that and an organization was underwritten by UNICEF. And then we've also acquired new server infrastructure to host the DIVOC platform, and that was paid for by UNICEF. So in short, the project really would not have been possible without them. And I want to acknowledge Mariko Kagoshima, who unfortunately is away in Japan today, but she couldn't be here. But I want to acknowledge her and her team for their commitment to Jamaica. eGov India, which is an NGO that provides open source software as a public good, and by that I mean they provide it free, has been a wonderful partner from our first call. On that call, they were incredibly gracious to us. We were searching for a solution, and they agreed to take on our project despite many competing applications from other countries. And they've really been a wonderful partner from here to now. Their DIVOC platform is currently used in India, Philippines, Indonesia, Sri Lanka, to name a few countries. And they have processed over 750 million records to date. So I think our 3 million citizens will be in good hands with DIVOC. Their digital specification is globally recognized and it's among just a handful of such systems, which means that our certificates, our Jamaican generated certificates, will be accepted by more and more countries as time goes on and the certification process becomes more standardized. Very, very importantly, DIVOC will plug in the soon to be launched WHO open source app that will be used by countries around the world to verify digital certificates. So that's really good news for us in Jamaica that we will have a globally accepted app. that we would be able to travel with. And more on that later as things develop. So in closing, Minister, I'd like to acknowledge the tremendous work put in by the three key teams in this event. I really have to shout out the ministry. Sean Bolton and his team, Albert Beckford and Denise Plum, have done tremendous work on this. And I will say, I'll close by saying that as a representative of the private sector, we stand ready for the next challenge in what is a truly challenging time. So thank you for the faith and confidence, Minister. And I'm proud that Jamaica now has a working digital vaccination system. Thank you very much.
All right. Thank you very much, Mr. Melheda, and of course for your support and the team that you represent, the various hats that you wear. Thank you so much. And you're correct about the partnership that happens between the private and the public sector. This time, one of our other partners now is UNICEF, that has been on board from day one in so many ways. And we're pleased to welcome Ms. Doneth Edmondson. She is the Monitoring and Evaluation Specialist at UNICEF, to bring her remarks at this time.
Thank you, Mr. Davidson. Minister of Health and Wellness, the Honorable Christopher Tufton, Mr. Melhedo and our other PSOJ colleagues, Mr. Bolton, members of the press, ladies and gentlemen, good morning. Let me add Mariko's apologies for not being here today. As Peter said, she's at home in Japan, and she's really sorry that she's not part of this event. But UNICEF is very pleased to have participated in this effort with the Ministry of Health and Wellness and the Private Sector Vaccine Initiative to bring digital innovation to Jamaica's COVID-19 response. UNICEF's role, as has been mentioned, stems from our global COVID-19 mitigation efforts. UNICEF is the world's largest provider of vaccines, and we procure more than 2 billion doses of vaccines annually for routine immunization, outbreak response in nearly 100 countries. And that includes diseases that we've gotten used to living with, like polio, etc. As such, UNICEF is leading in the procurement of vaccines through the global COVAX facility in partnership with PAHO, which the government of Jamaica has made good use of in facilitating getting vaccine doses for the COVID-19 pandemic. We've also partnered with the ministry to procure cold chain equipment and technical expertise to ensure that Jamaica has the necessary capacity to store and distribute vaccines in line with manufacturer standards. We must acknowledge the generous donation of the government of Japan to UNICEF to facilitate this aspect of the work, and note that there's more to come, as we are also working with the ministry to strengthen the provision of medical oxygen. Today, however, we are focused on Jamaica's digital response to the pandemic and the digital vaccine certificate, which is the culmination of months of hard work by our teams, and I have witnessed their investment. Early this year, UNICEF provided the government of Jamaica, as was mentioned, with the ComCare platform to help manage the vaccine rollout and provide real-time tracking of vaccinations and engagement with the members of the public. With the certificate being launched today, Jamaicans now have the ability to provide certified proof of their vaccination status at the touch of a button. As people move around the world again, this will help us to travel with a bit more ease and to have quick access to the certification wherever it is requested. While we acknowledge the investment of time and talent of our local partners, the Ministry of Health and Wellness, eGov, and the PSVI teams, we have to acknowledge the work of our colleagues in UNICEF's Latin America and the Caribbean Regional Office, as well as our headquarters in New York. They have been just as committed and excited about this work as those of us here on the ground in Jamaica. Minister, please be assured that UNICEF intends to continue to invest in this element of our partnership. The government of Jamaica continues to lead the Caribbean and Latin America with innovations in its digital health capacities, and UNICEF is proud to stand with you as a partner in this regard. We look forward to working with the team to deliver even more innovation, not only as we respond to the current public health threat, but also the expansion of the digital health in childhood vaccine deployment as well. On this note, I will close and thanking you, and let me wish everyone a safe and happy Christmas. Thank you.
Thank you very much, Doneth, and of course for the support of UNICEF, and please give our regards and our best wishes to the team. At this time, I'll just invite our Minister of Health and Wellness. He's coming to officially launch and give us his remarks for the vaccination cards.
Thank you very much, Stephen. I'm going to remove my mask. Distinguished ladies and gentlemen, Mr. Master of Ceremonies, Stephen, our Communications Head at the Ministry of Health and Wellness, Ms. Doneth Edmondson, Monitoring and Evaluation Specialist at UNICEF, representing your country head, who is away, I believe, at her land of birth, all the way in Japan. We want to wish her all the best in terms of her badly needed break. UNICEF, of course, an important partner. Mr. Peter Meledo, I see you here as chair of the Logistics and Operations Private Sector Vaccine Initiative. That's what I knew you as in terms of titling, but you're adding another title. We'll accept it. We do believe in the partnership, and I think it's important, and this is a manifestation of that. So let me thank you, sir. Mr. Sean Bolton, who is perhaps one of the quietest members of the Ministry of Health and Wellness team, but also one of the most hardworking, dedicated, and extremely talented. And he leads the ICT team here at the Ministry of Health and Wellness, and he has been championing this cause well before COVID, and I'm happy that he's now seeing some of the returns on that labor. I want to recognize him and the team at the Ministry of Health. Members of the media, ladies and gentlemen, so yes, it is true, we did have a false start when we were to have launched this very important digitization program, and I noted the headlines, ministry misses the deadline. It didn't say the ministry and the private sector initiative at UNICEF, it just said the ministry. Well, that's how things are, you know, when it goes awry, we get the burden. When it doesn't, then, you know, we all share the praise. But that's good too, and we recognize that, and we have no issues with that at all. The fact is that we were careful, the team was careful to try and avoid all any glitches at all. No, that is not to say we will not still have some glitches. And I want to make that very clear. The truth is there are some elements of the system that are going to almost automatically expect adjustments. And indeed, it's built for that, Sean, Peter, and Doneth. The first one I see that is going to be very obvious because of the calls I've gotten to date and emails and WhatsApp. Up to this morning, I got about 2 or 3, is the correction of information that was handwritten on the cards. And when you go to the site and you download, the site allows you to make the adjustment to the, so your name may be spelled wrong. You know, something may be awry in terms of the date of birth. Something there, but it allows you the opportunity to make those adjustments. So I want to just say early up front that it is now official that the site, we have gone digital in terms of our vaccination program. It's a good thing. As they say, good things are happening in public health. It's a good thing for partnership, UNICEF and the private sector, for collaborating on this, and this is the kind of collaboration that is required to advance the cause of the response to COVID, and indeed public health generally. So for all those reasons, this is just a very positive development today, and Peter put it right when he said we can boast now a system that's not just about Jamaica, it's global, it's accepted, and it will certainly place us in a tier among the world's population that allows us a lot easier freedom of movement, certainly as it relates to the screening process around the COVID response. So I am very pleased that we are here today. I'm very pleased of the partnership that has brought us here. And as I said, despite the minor glitches, the few days of delay, I am convicted, I'm convinced that it was well worth it, because we needed to iron out all or as many as possible of the kinks that that we needed to in order to make it a smooth transition. So the site is www.moh.gov.jm. And once you get to that site, and we're going to put it out there in mainstream media, in social media, and otherwise, once you get to that site, it gives you some simple instructions which will be demonstrated momentarily. In fact, I'm going to be downloading my digital card. Sean is going to help me with that to show that it is not that difficult. However, if there is an issue, for whatever reason, or I suspect the second barrier to being online and uploading and having access to your card digitally is likely to be the extent of your technological awareness. All right, so there are people who may be intimidated by the technology. And so one of the things I want to say is that you can go to a health center if you cannot manage it online. Get someone to help you if you can't. But we do appreciate that many people may not be able to or have help. Go to your nearest health center, ask for assistance so that they can assist you in registering and downloading that information. The third thing I'd say as a potential barrier, which is easily overcome, is that for me, I would put it on my phone and walk around with it so that when I need it, I bring it up and it is scanned. The truth is, though, that some people may want a paper-based card, right? So you can print it and put it in your file or put it in your passport or in your wallet or whatever it is, in your bag, and take it with you. And indeed, I would certainly encourage persons as we move around, and in light of the new and emerging trends around vaccination screening, that they carry evidence of being vaccinated with them, just as you would your driver's license or any other form of identification. I think it's very necessary, because I believe that there's going to come a point when persons are going to ask for evidence of being vaccinated before you get access to certain, whatever the situation that you're seeking access to. So the rollout was made possible, as said earlier, through the collaboration with UNICEF and e-Government Foundation out of India. And again, that partnership therefore extends beyond Jamaica. Yes, we had excellent partnership here, but the e-Governments Foundation out of India played a very important role. The digitization of the cards provides Jamaicans with a secure and universally accepted card designed in accordance with the World Health Organization standards. So it's internationally accepted. Features a quick response or QR code to enable the validation of the information in the card and of the person's vaccination status without violating person's right to privacy. So your card is your personal data, personal information, and you should protect that. And you should choose who you want to share it with. It's your right. This is not an intention to, and the system is not designed to expose your information to all and sundry. It is built in with security features, which I believe Sean could explain further later on. It is accessible, as said, by a mobile phone or other electronic device, provides for ease of travel, as the QR code is readable on international platforms. In addition, there's the ability to generate a new card on demand, and it can be printed on normal letter-size paper. So again, I wish, in keeping with the spirit of collaboration, to recognize this achievement today as an important achievement towards the response to COVID, to thank the e-Governments Foundation, this is of India, and UNICEF for their partnership in the delivery of the card. And just by way of information, e-Government is a not-for-profit organization that has developed an open source, flexible, and extensive software called DVOC that is designed to facilitate certification of large-scale vaccination using open source technologies and scalable data-driven architecture. DVOC is a part of the Foundation's open and close quotation, which is an open source digital infrastructure provided for governments to streamline public governance and administration. So it's an attempt at promoting good governance globally. And of course, the response to COVID is very important part of that good governance infrastructure. So the Ministry of Health, of course, has partnered, and the other partners, UNICEF, the private sector, to ensure that we will have also a DVOC certificate. What does that mean? It legitimizes the process. Is that what it does? So the system will be launched or is being launched now. Now, we do anticipate that there will be a rush to get on the system. I don't know if that has implications for slowing down the responses. I'm not the techno guy here, but I do understand traffic. There's a lot of it out there right now for the season, by the way, so expect delays. And maybe we can use that analogy and say, when there is a peak, expect perhaps some delays, right? Just as a word of caution. And if you don't have to go on today, you may want to wait a day or two, wait a day or two. The point I'm making is, let us not allow good to be the enemy of the perfect. Is that how it's referred to? Maybe, somewhat so. In other words, if you have an issue and you need to make some corrections, it will work itself out. And this is not an attempt at saying the system is not a very good system. I've done it myself, and I know it is. But I don't want us to get overly excited if we don't have to, because we are confident that the system works, and it will work for you and for all Jamaicans who require it. A final thing I'd say is that this is all in keeping with a number of other initiatives that involves partnership on the COVID response, which we're very proud of. We know that we have to evolve over time, that the way we started is not the way we're going to end as it relates to the COVID response. Living with COVID is going to have to mean mainstreaming certain features of our society, making tests more available, home tests. As the technology evolves, the accuracy of these tests does make them a value addition to what we're doing, access points, and I could go on and on. So I say to Jamaicans, we are evolving with that process, and even with the anxieties around variant strains and the likely challenges it may cause, my wish, my urge to all of us is that it's not a cause to panic, it's just a call to pivot and to adjust and to try to normalize our lives as we overcome any risk that may pose from varying approaches or responses through variant strains. So again, thank you very much. This has been a really good morning. I think good things are happening as it relates to the public health response, and I believe the Jamaican people will be better off for it. Thanks again for the collaboration.
All right, thank you very much, Minister. So now we'll get a chance to see the system and how it works. And Minister described Sean as the gentle giant or the silent giant in the background. So we're bringing him to the foreground now, and we're going to invite our ICT lead, Mr. Bolton, to share and to demonstrate the system, the vaccination card system.
Thank you, Stephen. Good morning, everyone. All protocols observed. I will be demonstrating, let me just remove the mask for clarity. I will be demonstrating how the system will work. It's pretty simple. You need to go to your browser on your mobile phone or on any device that you have, PC, desktop, laptop, mobile phone, etc. Simply go to the ministry's website, www.moh.gov.jm. Then go to Vaccination Resources. Simply scroll down to Vaccination Resources. Then it says get a valid COVID-19 vaccination certificate. Click on that. Then click the link, get vaccination certificate. It will take you to the portal where you can download your vaccination card and also to validate if a vaccination card is indeed authentic. So we'll go to download. It will ask you to enter your 10-digit number, that's 876, and your other 7-digit number. I will enter the minister's. Let me take this off for a second. Huh? For privacy reasons, I'll stop sharing screen. So I'm entering the minister's number. You will get another message to enter your OTP, that is your one-time password. You'll receive this on your working mobile number. And it's a 4-digit code, which is 9566. Then you'll click on login to portal. Once you log into the portal, then it will it will load. All right. Sometimes it takes a few seconds based on the load that is there. The number is still being shown, so I will have to take off the screen until it loads. In the meantime, it's loading. In the meantime, it's downloading. I will now present how it will look for the validation aspect. So once you go to the site again, you click on validate. It will ask you to scan with your QR code. So for entities or organizations that want to validate whether or not a particular person has been vaccinated, then you can simply click on that scan option, and it will ask you to have access to your camera. You have to give it access to the camera. Once you click on allow, it will bring up your screen, and I am having a face camera, so you will have to scan the QR code in front of the camera. All right. So this can be used for businesses or any event that basically uses this technology. So I will go back to my other screen. So as mentioned before, there are times when it will take a few minutes to load based on the load, how many persons hitting the site at once. Minister, could you give me the code again, please?
Sure. It's 0059.
So you can do this as many times as possible. Right? Each time you go in, it will send a new secure code to your phone. So it is taking a few. So what will happen is that you will definitely need to preview your card before before you actually download. That will allow you to ensure that the information is correct. If your information is not correct, you simply go back to the ministry's website. I will share screen again. Go to the ministry's website to say verify your vaccination details. Once you go there, you click on the button. It will ask you for your first name, your last name, and your date of birth. If for any reason any part of your name is spelled incorrect, then it will bring up a message that will tell you to upload your data. So I'm just using a fictitious name. And a fictitious date of birth. Enter your TRN and your mobile number. So if you see, based on the information entered, this means that some part of your name did not match on the database. So to ensure that the correct information is there, we ask that you enter your driver's license, national ID, passport, or a letter from the JP. Enter your identification number. You will upload your ID card to ensure that you are the person that is actually making the edits to the information. To your gender. If any part of your vaccination card is incorrect, you can also upload the front part of your card and the inside of your card. Once you have done that, you can also update your information, such as your address, to have the most recent information for you. Then you will click on I am not a robot. Click on I am not a robot, and then you submit. Once you click on the upload choose, it will take you to, if you're on a mobile device, it will take you to your gallery. All right, so the card is now there, your vaccination certificate. So on the certificate, you will see your full name, so you ensure that the spelling is correct for the first and last name. If you want your married name on the card as well and it's not presented, you can also go to the link and to update your information. Ensure that the sex is correct and the date of issue is actually the date in which you download the card. So if you look here, it will give you your vaccination details. Dose 1, it will give you the date, the type of vaccine that you took, AstraZeneca, and the batch number and where you took the vaccination. It also gives you the country of vaccination. It displays your second dose, if it is a 2-dose vaccine. Similarly, it gives you the vaccine information and the batch number and where you took it. So to allow this to be very mobile, you can use your mobile phone. Simply click on download and you can save it as an image or a PDF to your mobile device. So I will save it as a PDF. So once you save it as a PDF, it is saved to your download folder on your mobile device or personal computer. For those that want a physical card or physical certificate, you can simply click on print. Once you click on print, it will bring it will display all the printer information. You select your printer information, and then you can simply print the card. And that is for those that want the physical certificate. So if you actually go to the permanent vaccination center, you can also get some assistance, as mentioned by the minister, to have them assist you in printing the card. Thank you.
Sean, there are a couple of people online who are saying that their date of birth is incorrect. Is that possible to be corrected online?
Yeah, so you need to go to...
Just repeat it for me, that those who say that something is incorrect with the date of birth are
Right. So if something is incorrect with your card, you go to the MOH website, moh.gov.jm. You go to vaccination resources. Click on vaccination resources. My internet is a little slow. Right, so you go to vaccination resources, simply scroll down to verify your details. Once you click on verify your details, it will ask you to enter your first name, your last name, and the date of birth. Because it is incorrect, you may get a message that says, based on your information entered, it does not match what is on record. And indeed, you have seen that where it is incorrect. So we will ask you to upload a picture ID and the any part of the vaccination card that you deem is also incorrect. So you click here, enter your first name, last name, and the correct date of birth. As mentioned before, it will tell you that it doesn't match. We will ask you again. Let me enter just one more time. So it will tell you that the information is incorrect. You will need to upload your driver's license, national ID, or passport, or a letter from the JP, enter the identification number, and upload the card. You'll also need to enter your gender as well. And this information will be updated, and then you can pretty much download the new card within a few days.
The most, if I may, let me just, you're finished, right?
Yes.
So what I would say is that I'm just monitoring online some of the feedback that's coming in, that the most significant potential, should I say, challenge is faced with the site is likely to be information that is not accurate, was not accurately entered or written. Human error, if you will. So whether it is a date of birth or a name spelling, the system allows you, as was being described by Sean, to go through. You may have to enter your passport number, your driver's license, or TRN, so that they know that you are who you say you are, because if you don't do that, then it's going to reject any adjustments that are attempted. But once you would have done that and make the adjustments, then you'd have the correct information that then can be downloaded. Should you have difficulties for those who have this type of error, which I believe will be the most common error, the data input, then you can, if you are uncomfortable with the technology, visit a health center and get a permanent vaccination site and get that support to get it done. So I just want to make that clear. So try if you can. If you can't, then a vaccination site will assist you in getting that information. All right, thank you.
Thank you very much, Minister. Thank you, Mr. Bolton. So there you have it. We have gone live. And of course, we just remind persons just to be patient. And it's going to take some time. So just exercise patience. At this time, we're going to take some questions from the media as we bring this to a close. We're going to go to Althea Saunders from the Jamaica Observer.
Hi, good morning. Are you hearing me?
Yes, good morning, Althea.
All right. So my question might be a little bit long-winded. Just bear with me. I have one observation, and I was just wondering, this is for Mr. Bolton. It seems like a lot of steps, even though you have said it's pretty simple. I was just wondering, would it not be simpler, instead of having to input all your information all over again, that's the user, would it not be simpler to, if the person identifies an error, the system is set up so that the person can pinpoint the error and point out that this is the error, this is what needs to be corrected. Instead of going through that whole process again where you're being asked to put in your info, upload the ID, the Vax card, and so on. That's the difficulty I have had this morning. And of course, the no records found, that came up for me as well. All right, so my question is, how long does it take to correct the error? When can persons expect to have the correct Vax certificate? And this is for the minister. Is there an emergency provision for issuing of cards? For example, well, some persons were advised, you know, if you're not traveling before X time, you really don't need to go and correct your card for those who had errors on the paper card. So is there an emergency provision where if persons are trying to download the digital card, they're having errors, but maybe say they're traveling tomorrow or on the weekend, is there a provision where persons would have access to their correct information?
Ask Mr. Bolton to respond, and then Minister can add in.
Okay. So we ask for all the information so that we can validate that the information that you would like to change is actually correct, and you are the person that would want to change this information. And it's your information, right? We don't want unscrupulous persons to be, you know, making changes to whatever information that is on the card. So we need all that information so that we can validate that it is you. As it relates to the timeline for that to be done, it is within 72 hours. We have to ensure that you are the person. We have to validate that as well, and also to make changes to the information that is on the system. Once that is done, then you'll be able to download your information once more. That's it. All right. In case of emergency, you can also visit a fixed vaccination site to get some assistance in changing your information. Once you go to that site, you will also need a valid identification card before it can be changed. Over.
All right. Thank you very much. We're going to go to David Salmon from The Gleaner.
Good morning. Can you all hear me?
Yes, good morning. Go ahead.
Excellent. So I have two questions. My first question is, will the certificate also show whether people have received a third dose or a booster shot? And secondly, we have heard reports where people have been able to get cards for a fee. What measures are being put in place to ensure the integrity of the system is being protected?
I'll ask Mr. Bolton to address it as well.
I will start with your second question first. We ask for your identification card so that we can validate that who you are is who you are. In terms of getting cards, this is a matter that is actually dealt with at the vaccination center, where we ask for your vaccination card. Your first question is, what's the first question again? Could you repeat your first question?
My first question
third
is,
dose.
will the certificate also show whether people have received a booster shot or a third dose of the vaccine?
Yes, it will for the next release, which is in another 2 weeks. We will have that added to the vaccination certificate. Right. So the data has to be inputted for us to update the certificate.
I think Alpha is asking if there's a reason why we don't ask the user to pinpoint the specific correction. Is there a reason why we don't want him to do that? To say the name, just to show.
Okay, so what we have experienced is that you may pinpoint just your birthday, and there may be an updated address, in which then it will be another series of processes for you. So what we ask is that you upload your identification card, so we can validate all the fields. Ensure that your name, date of birth, address, and all the information about you is indeed correct.
All right. Thank you very much, Mr. Bolton. And I think those are all the questions that we have from our media colleagues. Alfie, you have a follow-up?
No, Stephen, but I kind of feel like the question has not really been answered, because what I'm wondering is, I understand the point of not wanting unscrupulous persons to be manipulating the information, which I guess is where the ID would come in. But I'm just thinking that for persons who are not familiar with the platform and technology, it might be a bit much to be putting in all of their information all over again. I don't know what the guarantee is for if you're putting in your information all over again. That means, you know, there's nothing untoward. It must be you putting in the information, in other words.
All right, let me have Minister respond to that.
I think we have to be careful about those assumptions. I understand the concern around the data to be inputted, but you know, in technology comes with downsides. People take pleasure in applying expert technology or alternative means of invading or stealing information for various reasons. It happens every day. I think the question being asked by the previous reporter around how do we ensure that the information is secure is a very relevant one, because you know it's a very the technology can be breached if we are not extremely careful. So what this requirement for information upload is, it's an additional security feature. So yes, it does take some effort, but it is an important security feature to validate that the person who is requesting a card is who that person said they are. Otherwise, you could end up with duplications and all sorts of things, people having people's birth dates and because they have access to their information. We can't do that. Or just mischief, people changing up people's cards for one reason or the other. There are people who see that as part of their energy should be placed in that direction. So it really is a security feature, and I think it's an important one. And I do believe, too, from the person's perspective, from the citizen's perspective, they really should see the investment in time to fill the form out or to add the information as part of their own protection. In that when they get their card, they are the only one who is privy to that card and the information on that card, unless they choose otherwise. So it has to be viewed also from a personal protection standpoint. And I think we have an obligation to ensure that that is the case. Remember now, though, if you have problems, go to a fixed site and get the information. Thank you.
Thank you very much, Minister. And I think Peter wants to chime in as well, so we'll allow Peter, Mr. Melhedo.
Yeah, I just realized, Minister, we hadn't answered one of the questions, which is about the booster. So the system, the DIVOC system has that functionality. We chose to delay a bit on that because we wanted to make sure we had the basic functionality in. So I think we're programmed for the second, Sean, or the third week in January to have that functionality as part of the offering. So just wanted to answer that question because I realized that it hadn't been answered. Thanks.
All right, thank you very much, Peter, and thanks to all our media colleagues for those questions, so we can bring clarity to your concerns. So at this time, I'm just going to close and thank all our participants. Thank
Shop safe. Get vaccinated. Wear your mask, keep your distance, and sanitize always. This was an important message from the Ministry of Health and Wellness.